Chagas disease for medical student. Chagas disease is caused by protozoan called Trypanosoma cruzi, the most common in Mexico, Central and South America. The most common cardiac manifestations are biventricular heart failure, the right side is more than the left, with cardiomegaly, ventricular apical aneurysm, mural thrombosis with embolic complications, fibrosis leading to conduction abnormalities like heart block and ventricular tachycardia. The gastrointestinal manifestations include progressive dilation of esophagus and colon. Now, the patient most likely with chronic Chagas cardiomyopathy um, can have a natural history of Chagas disease, which consists of three distinct phases. The first is an acute phase of mild, non-specific symptoms with fever or myalgias, followed by an indeterminate phase with serologic or parasitic evidence of T. cruzi infection in the absence of signs or symptoms of the infections. The final phase is chronic Chagas cardiomyopathy and gastrointestinal disease. The chronic Chagas cardiomyopathy is leading cause of dilated cardiomyopathy in Central and South America. Patients can remain asymptomatic for several years or develop symptoms of heart failure. Findings of right-sided heart failure that includes JVD, ascites, edema. They are more pronounced as compared to the left heart failure. Symptoms, those can be dyspnea or crackles. The patients frequently develop arrhythmias including sinus node dysfunction, complete heart block and ventricular tachycardia. The echocardiogram shows varying degree of bilateral dysfunction along with the left ventricular apical aneurysm, which is considered pathognomic for Chagas cardiomyopathy. Here, for the Chagas cardiomyopathy, there could be some differentials like moderate to heavy alcohol consumption, which can lead to dilated cardiomyopathy with global hypokinesis and dilation of the left ventricular cavity. The segmental dyskinesia and apical aneurysms are not typically seen in patients with alcoholic cardiomyopathy. Now, another differential could be berylliosis or the Lyme's disease, which is a tick-borne illness caused by an infection with the Spirochete Borrelia burgdorferi. Lyme carditis usually manifests as varying degree of atrioventricular conduction block. In rare cases, patients can also develop myopericarditis with dilated cardiomyopathy. However, apical aneurysms are not typically seen in patients with the Lyme carditis. The another differential may be giant cell myocarditis, which is a rare form of idiopathic cardiomyopathy thought to be mediated by an autoimmune process. Depending on the severity, the echocardiography findings in the patient with myocarditis can include left ventricular dilation with segmental or global left ventricular systolic dysfunction, but usually apical aneurysms are not seen as we see in Chagas cardiomyopathy disease. Thank you.